the back of recently receiving FDA clearance, I'm pleased to be joined by Dr. Adrian Cohen, founder and CEO of Headsafe, as well as Dr. Trippner, CFO of Headsafe. So let's begin with a very simple introductory question for you, Dr. Adrian. Can you please share why you started Headsafe and what your mission is?
Very happy to do that. And thank you, Daniel, and thank you everybody for joining in. I've got to say, I should mention from the outset, Daniel, we only make non-investors call us doctor. Everybody else, Adrian and Kai, is fine. So you're part of the club, so feel free to be pretty general like that. We are actually not that frightening to get on with. So my background is I'm a doctor, and I worked predominantly in what's called pre-hospital medicine. I got out there after my time in the emergency rooms and worked with the Westpac rescue helicopter in Sydney for over 10 years. And my job was literally going out to where the accidents happened. And that's where I really fundamentally believe we can make the most difference. That vital first few minutes, sometimes that first half hour or an hour, is far more valuable in the long term than working in a nice, well-lit, well-appointed hospital with all the facilities. But by the time somebody gets there, it might be too late. Now, my personal interest, because I come from a sporting background and I played my entire life, was in particularly spinal injuries and head injuries. And the two are connected because they are the product of the force of collision, either with somebody else, with the ground, and that's an energy transfer to the brain. So I created a program called NextSafe, the acute management of spinal cord injuries, and Headsafe, the acute management of concussion. That's part of the education mandate from where we come. So as a company, that philosophy has continued. I've continued to work with, in fact, the same rugby club that I started with as a 7-year-old, Randwick Rugby, and I've been working their concussion program there for over 6 years. We created it, we've got great support from their board and all the players and a number of internationals. And our mandate as a company is the elimination of preventable head and neck injuries through advocacy, awareness, and research. And in the midst of all of that, particularly the research, I saw the same gap that everybody else sees, which is that diagnosis of concussion is a very ill-defined science. And in fact, the way that it's done leaves everybody confused. The viewing public don't understand why one player is taken off the field or another player is back on after only a week. From the science point of view, we've known it's all been quite fuzzy. There's quite a lot of contention. And I used all the tools that I was given as a doctor to try and diagnose concussion and management. And the long and short of it was those tools were not very sharp. Now, we all know when we're dealing with sports people, they're quite unique individuals. They're very highly motivated, they're very positive, but quite often they'll tell you what you want to hear because what's really important for them is getting back on the field. So we're getting their subjective symptoms. You got a headache? No, it's all fine, doc. Are you good to go? Oh, yeah. You know you're not actually walking straight. Oh, yeah, I'll be fine. So that sort of thing leads to this whole aura of subjectivity. And even a number of the tests that have previously been done, we're asking people about their symptoms. We're asking them to demonstrate that they can do things. We're asking them memory questions. And in this day and age, we might do that at the beginning of the season and then try and see what the difference is during the year after an injury. Now, athletes as young as high school are being taught to sandbag those tests. In other words, don't go as well as you can the first time round, so you don't look so bad after you're injured. It's a well-established, well-documented phenomenon. Even if they're doing complicated cognitive tests, say on an iPad or in a computer lab, we don't know that they're actually telling us the truth or just what we want to hear. You know, it's tantamount to the old days of the doctor going into the player's room and saying, hey, am I holding up 3 fingers? Yes? Oh, well, you're good to go. So you get subjectivity from the point of view of the doctor as well, or the person examining, because they've got a coach in their ear telling them, hey, I need this player back on the field. We needed objectivity, and so we went out to try and find it. So our motivation was to actually look after the people who are on the field, to get them off the field when they need to come off, and not let them return until it's safe for them to do so.
Excellent, thank you. And you've obviously been on quite a journey over the last few years in trying to achieve that mission. And one of the key milestones is achieving FDA clearance, which you received just a few weeks ago. Can you speak to some of the lessons learned for any founders listening, and any tips and tricks for going through that FDA process and attaining FDA clearance?
Absolutely. So as a doctor, I knew that every piece of medical equipment that I picked up had been through a regulatory body. In Australia, it's the TGA, Europe, the CE mark, in America, the FDA. And our market's clearly the FDA in America first because of the size of the market there. But let me tell you, getting that approval is about as much fun as repeatedly sticking the pen that I can't find on my desk here repeatedly in your own eye if you don't know what you're doing. Now, that's not to say there's magic involved or luck, because all these processes are well documented. So we had to go through, and particularly myself, I'm not a neuroscientist. I didn't come from an academic background. I'm a very practical, hands-on-the-ground doctor. Having to understand the systems in which I was working was paramount. And if you've got a spare, 3 or 4 days, by all means, download ISO 13485, the medical device spec, and give it your best. And after you've done that, you can look at the American specification. That's CFR 21 Part 820, and it's only a couple thousand pages. It's a really great bedtime reading, particularly in this day and age if you're having trouble sleeping. These are the standards that you've got to adhere to. And essentially what they are, quite logically, are just ways of demonstrating that your product is safe and it's effective. Every time we pick up a piece of medical equipment, we need to know that it's going to work, that it's going to work properly, and of course that it's safe. We see the same things on consumer devices as well, but it's a lower standard. So there are medical device standards that you have to meet, and the FDA is the place where you put your submission, and they go through that exhaustive checklist. So it's not a crapshoot. You know what they want. When they say they want an electrical safety standard to our very favourite IEC 60601, the International Electrical Safety Standard, another piece of riveting reading, believe me, you have to do it. You have to do the test. We did the biocompatibility test. In this day and age, cybersecurity has become incredibly important. So we've got a device that speaks to an app in a smartphone that goes to the cloud, and everybody's worried about security of that and also about privacy. So we've built our app with all the cybersecurity provisions that we need to know that a third-party actor can't get in and pollute the results. I mean, can you imagine we're at the Super Bowl in a couple of years' time and they go off on the sideline to do a Nurochek on the star quarterback, and somebody in the stand sitting on their iPhone putting an adverse result in? Yep, that just can't happen. It can't happen because we've gone through all the checks and balances to make sure that it doesn't happen. So having put all that dossier together, we go to the FDA and they look through it and they make sure that we're a safe device, that we're not doing anything that's dramatically different from normal, that all the safety specs are met, and then they go, you're now cleared for sale. So my advice to founders is, if you're going to get in this field, you need to understand what you're undertaking. You need to understand the environment in which you have to work. You need to understand what the FDA is trying to do. And along our journey last year, we spent 6 months at Houston as an invited international company to the Texas Medical Center. We were actually addressed by the guys from the FDA. And despite everybody's assumptions to the contrary, their message was quite clear. We're not the big bogeyman that's actually trying to go out and trip you up for no reason. We've got a job to do. We want to help you. We want to see life-saving devices on the market. Our job is to make sure they're safe and effective. And if you can show us that, then we'll be happy to help you along the way further on.
Understood. And I think we've got an audience question actually off the back of that. And you say the FDA aren't the big bogeyman trying to trip you up. But has there been anything that, or what has surprised you the most with the FDA application and approval process?
So we did work with advisors for this. Again, if I'd been from a medical device background and I'd worked in companies and we had a QA and an RA department, then we could have done that as quality assurance and regulatory affairs. But, we're a small company, so Kai and I were the only full-time employees at the time this all started. And we've subsequently got a postgrad with a research background in neuroscience and biomedical engineering along the way. But we needed the advisors who'd been down this trip before. We can certainly help people if they want to ask us about those specific individuals and who we would recommend. We've learned a lot along that journey. But I think if you've got people who come from that environment, who are used to doing it, who put in 10 or 20 different applications each and every year, they can save you a lot of time and a lot of money. Now, there are big firms in the US. Typically, this is like lobbyists, you know, people that used to work in government come out and start their own firms. Same thing with the FDA. And so there are a number of very big, very well-known firms who offer full service and charge, particularly in American dollars, what is a truckload of money. You don't need to go to them. We've actually found a relatively small company, but with an advisor that actually worked for the FDA and has a neuroscience background herself. She was absolutely perfect for what we have done. And so we'll be going down that track with them. So unless you've got that expertise in-house and their expertise is current and they've had lots of different devices, lots of different interactions, thoroughly recommend you finding yourself the right advisor to make your journey easier.
Maybe to add to that, the advisor that we worked with did not just have experience, but a very well established network within the FDA. So whenever there were problems that appeared that had to be cleared, she was able to pull the strings and get the right people on the phone. So that was very helpful, especially in last year when there were some questions that were not easy to understand from the outside.
Excellent. Thank you both. And you've actually just answered a question that's come in from the audience about your previous FDA management experience and how did you prepare? And the answer is, you know, getting a trusted advisor who's been through the process before is really critical. So I want to change gears a little bit from FDA clearance now into go-to-market. And there's obviously a lot of uncertainty around sport as a result of COVID-19. Can you talk to how that affects Headsafe and your go-to-market strategy subsequent to receiving FDA clearance?
Yes,
well, like everybody else, we've been delayed. You know, there's no doubt about that. But then there are some things that won't change. I mean, sport's not going away; it's coming back, and not just at the elite level, because you know everyone focuses at the elite. We're really about the community level, and we know how powerful and important it is in bringing people together. So sport will return. Our research will go on. The work that we're doing on the ground and the sales team in the US will continue to do the work that there's just started over there. But you know, it's something that couldn't be predicted, but we just have to adjust for that. Sorry, Kai, go ahead.
No, so yes, we had a go-to-market strategy for the US that was in 2 stages. Stage 1 was always supposed to be what we call an initial product offering. You could also call it a kind of pre-launch or like a beta version of the product. So that was the intent of that stage was to learn from initial customers, from early stage customers that are willing to work with us and give us feedback, and also make a little bit of revenue to kind of on a soft side. And then stage 2 was always going to start early 21, where we go full force to market. So yes, we had initially planned to make a pilot with Harris County in Texas earlier, right now actually, and we had also planned to have some sales towards Mount Sinai in New York, who was interested to buy a number of units for pilot, and we were in discussion with a number of neurologists. So that has now moved towards the second half of the year, so we assume to pick that up in October. So yes, we had a delay, and we have to, of course, we have the uncertainty. Will it start in July? Will it start in August? Will it start in September? So we plan for October. But it does not really affect our company's total plan, because we will have less time to learn from that, but our full force go-to-market is still set for February, March next year. So that hasn't really changed. And we also are lucky by having a sales team in the US already. So our head of sales and one support are based in the US. So there is, for us, more flexibility to move around. And number 2, what we noticed in the last 3 months is people that we work with are quite happy to get on a Zoom call, for example. In the past, it was always everything had to be in person. So Adrian and I had a lot of travel last year in order to facilitate that on the investor side, as well as on partner side and on potential sales preparation side. And that has shifted a little bit. So as bad as COVID is, we actually find it makes, for us being based in Australia, still some things easier in regards of going and selling in the US.
And to that delay, a question from the audience: have you had any disruption in the production and supply chain?
We have basically our supply chain consists out of two major suppliers. One is mechanical parts supplier in Shenzhen, and they were down for a while, but they're up already again for quite a while. So they had to make some audits, some governmentally arranged audits, and they've passed it, so they're ready to go. And the second one is in Sydney, which is our final assembly as well as electronics, and they are also ready to go again. So if we would have wanted to produce something like 3 months ago, we would have been in trouble. Right now, it is not really an issue anymore. So as we can't sell right now, looking forward, selling towards August and October, it's not really an issue.
Excellent.
And
well,
importantly,
that's certainly
too,
good news.
Yeah, well, you know, it's very interesting because when we're talking to investors in some countries, part of their strategy might be that their investment is actually based there. So there are a number of jurisdictions that offer incentives, and we are flexible enough to be able to move our production if we need to. So we'd always envisaged, ultimately, it might all come from one area. It might come from Taiwan, it might come from Shenzhen, it might come from the US, it might come from Ireland, because, you know, obviously there's a number of countries that are looking for this kind of technology and offer generous concessions to be there. So we have retained the flexibility to be able to move.
So we are very IP and quality driven. So that's why we said that the manufacturer assembler and the electronics component as well as firmware is close to Sydney, right? We have that here with us because we want to control it. We have the possibility to outsource with this manufacturer towards China, for example, if we really want to, but we are not in that stage that we trust that. And we are also not in the stage that we want to give the quality control out of our hand, where we can be within 1 hour in a factory and check it ourselves. So that's something that we are not ready yet. So at some stage we might be doing that, but right now we are not.
Okay, understood. And another question from the audience, is FDA clearance enough to commence sales and your go-to-market, or will there be additional case studies or clinical research required to reinforce the product's viability?
So FDA clearance is the first barrier you've got to do to start selling a product. We can certainly do that into the brain assessment state straight away. Our journey, though, we see a number of research projects and a number of different regulatory approvals going through over the years. This isn't a one-trick pony. We understand to be more and more specific and to do the research in specific disease states, not just concussion, post-concussion syndrome, and that chronic neurological impairment that comes before, you know, in older ex-players, for instance, those who end up being diagnosed with CTE. What can we see in those people? And as soon as we do that research and come through with those findings, then we apply for that to be added to our clearance as another indication for use. Now, beyond concussion, which is, of course, an injury caused by a direct or an indirect force being transmitted to the brain, there are also illnesses of the brain that we need. Conditions like post-traumatic, like biomarker of disease. We have a way of electronically determining when something is going wrong with the way the brain's connections work. You know, the job of the neurons in the brain is simple. This guy's got to talk to this guy. They do it at what's called a synapse with some neurotransmitters, but there's an electrical activity that goes with that. That is disturbed in injury, and it may well be disturbed, we know, in various forms of brain illness. Our technology actually comes out of multiple sclerosis diagnosis 30 years ago, long before there were CT scanners and MRIs. We knew that the brain produced electricity and that in certain diseases of the nerves, that electrical conductivity actually changed. With that knowledge, we've brought a portable way of actually detecting that. It's essentially and glibly what we perhaps call a brain scanner that fits in a briefcase. Now, if we look at post-traumatic stress disorder, for instance, and PTSD affects over 1 million veterans right now in America and in Australia, it's tremendously important. We want to put our device into the testing regime for PTSD, and we should be able to elicit a change. And then we want to look at, from a therapeutic point of view down the track too, what can we do to help reinforce the electrical step back to what it should be? So we think of a lot of the diseases of the brains as manifesting in our behavior, in the way we perceive the environment, in our memory, in our cognitive processing. But essentially, way back down, there's damage to individual nerves, and as a result of that damage to the electrical conductivity. So if we can make that circuit better again, if we can restore that connectivity, if we can help reinforce those processes that were damaged, then we in fact have a way of treating these diseases. So for me, as a doctor, and as part of the fundamental mandate of our company, it's the elimination of the preventable aspects of these diseases and of these injuries. So what can we do to demonstrate them? What can we do to treat them? What can we do to manage them long term? And when we can do all of those things, we've got a solution in this neurological space that's of tremendous value.
Yes, absolutely. Sorry, Kai, did you want to?
Yeah, so there's to break that down in a go-to-market sense, right? So there are actually 3 market segments initially for the concussion space that are interesting to us. Number one is the so-called sports market, or the party with duty of care, clubs, schools, and so on. And that's we can actually sell to them. We have a device that is cleared. We can actually go to them and sell it. If we want to go to the hospital space, that's the next step in our, so the healthcare market, which is actually bigger market. Let's say the first market is about 300 million. The second market, the healthcare market, is about 1.7 billion in size. So if we want to go to that market, we have to prove a few more cases of concussion being aligned with our measurements, right? So therefore, we will still work with the FDA to get that clearance, and also to support payers to kind of reimburse. It's a different model of how we get money out of that market. It's a per test model, not just buying the device and paying a subscription fee. And then eventually we're looking at the $2 billion market, that is the home market, like the soccer mom who wants to have this device at home and wants to put it on the child. And in order to operate that completely freely of any expert, and not needing a prescription in order to order that device, we would have to do even more FDA clearance, which is not really the big part, but just has to be done, and the device has to be really clear, has to be usability tested a little bit more than what we've done so far. So yes, we will keep on working even in the concussion space with the FDA over the next years in order to get more and more freedom to actually market the device in different aspects.
Thank you.
And let's not forget that along that way, we are collecting a huge trove of brain data, not just from individuals with their injury this week and next week, but longitudinal. So we start with kids at school, kids at high school, kids at 14 and above as our indication. And by the time they get perhaps to a later stage of their life, even a professional career in their 20s or 30s, we've got 10 years data. So we're going to be able to help them understand when their electrical activity is different, they need to leave the field. When they've had the chance individually to heal, because people take longer, and some people take longer than others. It's a very personal thing, and you can't predict it. We've all got a different genetic and environmental background, different exposure, etc. But also we might long-term be able to tell people, now's when you need to hang up the boots, because your electrical activity is taking too long or not returning to normal. And, at the far end of that spectrum is when we get to the stage where people have suffered chronic damage, we're actually able to help quantify that. And particularly in the context of people who may be looking in terms of compensation, or maybe looking at terms in help, we're able to actually match their current status with where they are and any improvements or deterioration. So that's a longitudinal spectrum of information, and that's of tremendous value. So we do have a data platform associated with our device, and the ability longer term to even monetize that data, because de-identified data has got value. And the more information we have about an individual, that's of tremendous importance to them and their healthcare as they go forward.
Thank you. And obviously ties with your overall mission of mitigating preventable head injury. A question from the audience: Will your bigger market that Kai referred to require further FDA and regulatory clearance and approvals being met?
So the last market, like the kind of home market or the direct market, yes, it will need. So for example, we have currently usability studies that show that a professional can operate the device. In order to get to that market, we have to make sure that everyone, no matter how uneducated that person is, can operate the device and absolutely has no possibility to harm or make any mistake. So that is extra work, and we have to demonstrate that. Yeah, for the very last, this is a $2 billion market that we see as the we want to approach that market from about 23 to 2023. So it's not yet our focus, because we first want to get data and learn in the other market that's more controlled. But eventually, yeah, we will approach that market and have to go to the FDA again. Yeah.
But being specific, we don't have to reinvent the wheel each time.
No.
The actual technology has already been approved. What we'll be looking for each time is what's called the indication for use. Yeah. And that is just based on the previous information we've given them, further studies that demonstrate usability for that particular disease or condition. Now, if we change our device, when we go to a model, for instance, that we call Nurochek Pro, which will have an integrated screen and will integrate into a hospital's IT system, of course, that will require us to reprove the electronic components of that. But we're not changing the fundamentals of the design itself, nor the fact that what we are doing, the stimulus that we use for the eyes is safe, the way we pick up the EEG is also completely without potential for harm to a passive receiver. But yes, each time you go back with a new change to your device, you have to go through the structural parts of the FDA process. But if you're just looking for an indication or a new indication, that's something you demonstrate with research. The other interesting thing in this is an area of tremendous importance in America and to the FDA. And so what they are suggesting in our regulatory pathway is going to be looking for designation as a breakthrough device. This is in fact somewhat of a shortcut through with the FDA. Once you're in that category, they're obviously even more motivated to see that you succeed and to try and take out any of the bureaucratic barriers that might have been in the way. So concussion, brain injury, brain trauma is something that is high on their priority list, as are a number of disease states, as you can imagine. And so we'll be actually looking for that as well. And that's another significant valuation uptick when we get that. We actually have a device that's in a key area of concern for the FDA.
Yeah. Thank you, Adrian. One final question in two parts from me before we wrap up. You're obviously an Australian company based in Sydney. So the two questions, would it have been easier to go through the FDA process if you were in the US? And the second question, is there an opportunity to commercialize the device in Australia? And are you planning to do that with the requisite regulatory approvals?
So, yep, the answer is it probably is easier in the US, and you're surrounded by US-ness, but that's not mean it impossible from here. If you want to understand your market, you've got to be in the US, and you've got to talk to customers, and you've got to go through with a number of our research projects. So we're at Mount Sinai in New York, shortly at Columbia in New York, at the Baylor College of Medicine at Houston, but we also have research going in New Zealand and at Waikato University based here in Sydney. So you can do it from afar, but I think it's always helpful to be on the ground over there.
We have Idan and Claude there, right? So they help a lot. And Steffi, so we have a number of people on the ground that actually are kind of representing us over there in all aspects.
Yeah, so we have our sales and marketing team who have experience in this field before. So they're based in Houston and St. Louis. And we have the director of our US research, Professor Steffi Thompson, who's based at Baylor College of Medicine as well. So we've got good touch points in each of those key jurisdictions. Now, in terms of Australia and of Europe, well, our patent portfolio covers Australia, New Zealand, Korea, Japan, China, the EU, it's still one unit, the EU, although that may change over time, and the North America and Canada. So they're all markets we're interested in. We do have great interest in Australia. Obviously, it's our backyard. I don't just mean the backyard over there, which is Bondi Beach, for those of you who didn't recognise it. But we want to be here as well. And we'll approach the clubs and the leagues here, try and work with them. We do have interest from people who want to work with us to take us through the TGA process. Again, it's 6 to 12 months. And, you know, in general terms, it's somewhere between $70,000 and $100,000. Generally, and in the past, you used to do your EU submission first for Europe and then do Australia. That's become particularly difficult at the moment because the EU medical device system, frankly, at the moment, it's in a bit of chaos. And that's not just about Brexit or COVID. They've had a real change to the way they're doing things. It's been coming for 7 years. That 7 years has elapsed and nobody's ready for it. So approaching the TGA here, We've got groups that are interested in working with us to do that. We've got good experience. And of course, we'd love to do that and be an Australian product in Australia.
Excellent. Thank you very much, Adrian and Kai. We will wrap up here. I suggest to any founders listening that both Adrian and Kai would be happy to recommend any FDA advisors or consultants to you if you're going through the FDA process. But I'd like to thank both of you for taking part in the webinar and wish you all the best of success with Headsafe in the short and long term.
Thank you very much, Daniel.
Thanks indeed, Daniel.